Hi, Wendy.
Hi.
Thanks for joining me today. As you know, I'm Paula. I'm leading the advanced practice review for the NMC, and it's really lovely to speak to you today. I'm going to let you introduce yourself if that's all right, and perhaps you could tell us a little bit about yourself, what you do, how your career journey has been, and how you've been involved in the review of advanced practice. Is that okay?
If it's okay, Paula, and thank you for having me. So my name is Wendy Olayiwola. I am the National Maternity Lead for Equality NHS England. I'm a registered nurse and a practicing midwife, and I've worked as a senior midwife and clinical leader across various maternity and neonatal services with a strong focus on reducing health inequalities, improving outcomes, and advocating for culturally respectful, sensitive, and equitable care. So, and I've also been a specialist midwife, and a bereavement specialist midwife. I've gone through project management roles. So it's really been an honor to have this conversation with you. So in my current role, I champion inclusive practices in maternity and neonatal services, working closely with stakeholders, the systems and communities to influence national, local and regional policy and practice. So my involvement in the review of advanced practice stems from my commitment to strengthening professional leadership and career progression pathways within midwifery. I've contributed to discussions around how advanced roles can be aligned with public expectations and also to promote clinical excellence and support workforce retention, most especially. And most importantly, especially for underrepresented groups.
That's really great, Wendy. And you've had a really interesting career. Like you said, you're a nurse and a midwife, and you've been working in more strategic roles recently, and being able to influence and have that impact is really important. And one thing that you mentioned there was career progression, and certainly kind of the opportunity for career progression we've heard loud and clear, particularly from midwives who are perhaps, it's fair to say, at an earlier stage of the journey to advanced practice, and really do see this as an opportunity for career opportunities that perhaps they hadn't thought about in the past. So that's really great. Thank you. And you've sat on our independent steering group, haven't you, as
I
part of the
do.
work as
Yes,
well?
you did. Yes.
Yeah, brilliant. And it's been really helpful having you there, and having you involved in those conversations to get us where we've got to today. So I just wondered what your thoughts are around the work that the NMC is doing, and you perhaps touched on it a little bit, but thinking about developing additional regulation for advanced practice, particularly around risks and public protection.
Paula, I think being a member of the steering group has been an honor and a privilege to add value to this conversation. And I think it's an opportunity to also say a very big thank you to the team that have really, supported that. So I welcome the NMC exploration of additional regulation for advanced practice as a positive step towards strengthening public protection. So, with increasing complexity in maternity care and rising expectations of midwives in advanced roles, regulation offers that clarity, it offers that accountability, and the assurance for women, families, and the wider public. So, it also supports consistency in education, it supports the competency and the scope of practice, reducing variations and ambiguity, and helping to safeguard that high standards of care across all settings. So it's absolutely a welcome news for that additional regulation for HP.
Thanks, Wendy. Yeah, and again, some key words that you've brought out there, which we've heard throughout the review about bringing clarity, accountability, and assurance for members of the public.
Yeah.
who are being cared for increasingly by those working in advanced practice roles. So that's really, really great. Thank you. I wonder what you see as the opportunities and challenges around advanced practice for the midwifery profession. And I mentioned earlier that they're perhaps on an earlier phase of the journey towards advanced practice. We know within nursing, advanced practice has been around for many years, and there have been their own challenges within nursing. But I just wondered whether you had any thoughts on opportunities and challenges with midwifery, particularly with the development of additional regulation.
Yes, indeed. So advanced practice in midwifery presents several opportunities, and I think it's quite obvious. It enables career development, like I've already mentioned, beyond actually on this, excuse me, on this occasion, it's going to be beyond traditional pathways that we already know. It also it enhances clinical leadership at the point of care and supports better outcomes through autonomous. We do know that midwifery as we are autonomous practitioners, so it is also evidence-based decision making. So for the midwives, this can be empowering and lead to greater workforce satisfaction and retention, as already mentioned. However, those challenges obviously remain. So there is a need to ensure that advanced practice development is very inclusive. It does not exacerbate the existing inequalities that we are already, excuse me, that we are already aware of, and also is accessible to midwives from diverse backgrounds. So regulation must be clearly defined, communicated, and appropriately resourced as well. So with education of the frameworks and supervision structures in place. Also, we must also ensure that advanced practice does not obscure professional boundaries because, as we know, it could be. That's also a danger, but rather enhances collaboration within multidisciplinary team because it is important that it's not being seen as a silo, another silo skill set for our midwives and nurses. It must be obviously well embedded into that professional, multidisciplinary, way of working across the system.
Yeah, yeah, really, really interesting and really thoughtful points there. And again, you were talking about not obscuring professional boundaries, which is really important and something that we heard time and time again throughout our conversations with midwifery professionals. They want to be seen as maxi midwives, not mini doctors, which
Indeed.
we've kind of held on to that little phrase because it really captures that, doesn't it? And also thinking about the multi professional working, which I agree is really, really important, that we continue to work in that way for the future. Um, and also thinking about accessibility and you
Yeah.
mentioned education, but how accessible is education for all. That needs to be a really important part of our thinking as we progress the work. um, Wendy, I wondered what your thoughts are around the principles for advanced practice, which we know we've had approved by our council and will be launched on the 3rd of June. Now, the principles are just one part of a number of parts that will bring additional regulation into operation. So it kind of sets the foundation and sets out our expectations as a professional regulator of what good looks like, both for individual practitioners, but also for employers, and perhaps in a way that we haven't done before. So I just wondered, specifically thinking about the principles for advanced practice, what impact do you think they'll have on the profession and also on employers and public protection?
So in terms of the principles, I believe this will provide an important foundation for consistency and transparency. So for the profession, they will signal recognition of midwifery expertise and promote high standards of care and professionalism. And for the employers, The principles will also help guide role development, the workforce planning, and the governance structures. And in terms of the public protection, having that clear principle ensures accountability, it ensures role clarity and trust. So for us, women and families will always benefit from knowing that
Mm.
those in advanced practice roles are well regulated, they are competent, and they're working within that national agreed, framework that prioritize safety, that prioritize autonomy, and most importantly, that individualized, personalized care. So it is very important, and I guess each principle has that domain, both on the profession, the
Mm.
employers, and the public protection overall.
Yeah, I think you're absolutely right. We've tried to really highlight what the principles mean in terms of public protection, but yes, as individual practitioners, but also to support those employers or employing organizations that perhaps don't have the governance in place. So it kind of gives them something to be able to develop those governance processes. So yeah, I think that's really important. Um, I wondered what your thoughts were on the definition that's been developed of advanced practice. So you'll know, of course, that we ended with two definitions. We were really clear, and our public advisory group guided us that we needed to have a definition that was clear to members of the public. But our professionals felt they wanted some nuances within that, which were really important. So things like uncertainty and managing risk, etc., and that autonomy that you mentioned earlier. So we have ended up with two definitions. But I just wondered what your thoughts were on those final definitions, and whether you feel they'll bring greater clarity to women and their families on the role of the advanced practitioner in maternity services.
I think it's a great idea having those two definitions to start with, one for the professional groups and one for the public, because it is important that we carry the public along. It is important by carrying them along is important that they understand, the professional groups' roles, including the AP. So the public first definition of AP is absolutely a great idea and it's a great approach as well. So placing the needs and the expectation of the public at the center is absolutely fundamental in maternity care, for instance. And this is where trust, safety, and relational care are essential because in maternity and neonatal services, relationship matters, and it is for the relationship for us as midwives. We build a relationship based on clarity, which obviously integrates into trust. So this definition has that potential to really demystify the role of an advanced practitioner for women and their families. So helping them to understand who is caring for them, what level of expertise is being offered, and what to expect from that relationship is absolutely paramount. It also reinforces the notion that advanced practice is not only about clinical excellence, but it's also about advocacy, because for us at midwives, we are advocates for women, their babies, and families. And also, partnership is part of what our role is all about, and compassionate leadership. So ultimately, a public first definition support that transparency, it support that equity, the understanding and the confidence that we bring into maternity and neonatal services. Yes, so it's a great thing.
Thank you. Yeah, yeah. We worked really hard, as you know, to get that right. As I say,
Yeah.
with our public advisory group, Wendy. Throughout the conversation, you use all these words that just get me so excited. Talking about advocacy, accountability, building relationships. Relationships matter, and it's all critical to the work that we all do. Um, but but there is that special relationship, isn't there, between a midwife and a mother in a really kind of critical part of someone's life.
Yeah.
So I get that. it's been really great to talk to you today, Wendy. I don't know whether there was anything else that you wanted to bring up or mention in regards to the work that we're doing.
Thank you, Paula. I think what I can just say is it's an exciting time for us as a profession, for nurses and midwives, having the advanced practice being regulated, being taken forward, being supported. It's not just for the profession, it's also for those people that we care for, because it gives us that confidence, that autonomy that we can actually, not just for us midwives being with the woman, just advocating for them, but also going a little bit further in that profession autonomy. So it's absolutely an exciting time.
Yeah, it is an exciting time. And yeah, like I said, this is the first step. You know, the principles being launched and implemented across the UK is the building block. The first step. We've got a long way to go, but we'll
Okay.
get there. And you know, we've been on this bus. I keep saying a lot of times, and we are making progress, but
Yeah.
it's absolutely needed. And I really look forward to continuing to work with you, Wendy, to get us where we need to be.
It's all everybody's work on this. So thank you very much, Paula, for having me.
Thanks, Wendy.